have three pictures. This is the one I'm going to start with. It is a frontal schematic view, as if the patient is facing us. This is the patient's left, this is the patient's right, superior, inferior. We'll start down here at the superior portion of the heart, at the superior vena cava, coming off the SVC superiorly and laterally. We have the right and left subclavian vein. The left subclavian vein crosses in front of the great arteries here and the aortic arch, anteriorly and slightly superiorly. That's why it's kind of hard to see here, but from the aortic arch we have the great arteries coming off the superior portion. Right, middle, left. From the right we have the brachiocephalic artery, the left common carotid, and the left subclavian artery. There. Again, these great arteries are posterior to the left subclavian vein. Back to the subclavian vein, we have the internal and external, jugular veins coursing superior from the subclavian veins. The picture on the left shows the internals left and right there, a little more clearly without obstruction. The left subclavian vein, left external and internal vein, as well as the right side, right subclavian, external, internal vein. They make up the left and right brachiocephalic vein, which then feed into the SVC, which feeds into the heart. Again, we see the left subclavian vein, brachiocephalic vein, passing anterior to the great vessels. Move on to the trachea, which is a midline structure that sits towards the anterior aspect of the neck. This side shows a little more with some cartilage detail. The trachea sits anterior to the esophagus, but posterior to some cartilage, including the thyroid cartilage right here. Thyroid cartilage is the largest piece of cartilage and sits superior to the thyroid gland. Move on to that once I show you down here. So you generally won't see them on the same axial image, though sometimes you may see the thyroid gland at the base of the thyroid cartilage sometimes. Right here we have right side, left side, anterior, posterior. Like I said, superior, inferior on the last assignment. But we have the right lobe, left lobe of the thyroid gland, which sits lateral to the trachea and is positioned along the second through fourth tracheal rings. Again, inferior to the thyroid cartilage. The isthmus right here connects the left and the right lobes of the thyroid gland to join together anterior to the trachea. And then sometimes between the trachea and the vertebral body you can see the esophagus, which will sit posterior to the trachea and anterior to the vertebral body. Sometimes you'll be able to see it with some air. And yeah, thank you.